performing a modified NOTS test. This is a blood test to concentrate microfilaria, as well as be able to differentiate between dirofilaria or any other sort of nematode blood circulating microfilaria. So my supplies are going to be my 2% formalin. I actually had to dilute this out. We only have 10% in the hospital that I work for. So I took 2 mils of 10% formalin and diluted it with 8 mils of water, which gives me 2% formalin. And I have 10 mils of that, so I'm only going to be using 9. I have my 15cc conical centrifuge tube that I'm going to be using. I have a 3cc syringe to drop 1 mil of blood from my anticoagulated sample that has been recently drawn, and then I have a 12cc syringe to draw up that formalin. So I am making sure to wear gloves considering I'm using formalin. We want to make sure to be very safe with that. So I'm going to go ahead and get my blood in my tube. Oh, I got a 20 gauge needle on here to draw up that sample. I have a little bit extra, so I'm going to be able to put some back, which is good. If I can take the needle off for that portion. Toss that in my sharps container. Right. Perfect. So as you can see, I have 1 ml of blood. I think you can see that okay. I'm going to go ahead and place that into my conical tube. Inject that. Place the lid on that while I draw up my formalin. Now I'm going to take my 12cc syringe and open up my 2% formalin very carefully, and I'm going to draw up 9 mils. A little bit over. There we go. Close up my cup. It still has a little bit of liquid in there. Right, so I'm gonna cut close, and then you can see there are 9 mils of 2% formalin. So I'm going to place this in my tube as well. Inject that right in there. Right, perfect. And it does come out to the 10 on the side, so that's pretty cool. Make sure I know I'm doing it right. I'm going to go ahead and seal this off entirely, make sure we get a really good seal. That one's down all the way. It's kind of hard on the side, but I'm going to hold my finger on the top and I'm going to go ahead and invert it a whole bunch, kind of mix it really thoroughly. Okay, so the next thing that I'm going to do is I'm going to go take this to be centrifuged. So the only centrifuge we have in our hospital that is able to fit this size tube is going to be all the way up in our clinical pathology lab. So I'm going to go take this up there. I'm going to spin it down at 1500 RPMs for about 5 minutes. So I'm going to let that run. When it's done, I will pour off my supernatant, draw up a couple mils, not a couple mils, I'm sorry, use a couple drops of new methylene blue, put 1 drop in there, mix it up really well with the sediment that's on the bottom, and then that's what I'm going to be placing on my microscope slide. Great, so I'm going to be placing my tubes into the centrifuge. I have my balance right here. It's about the same amount. I'm going to set that on one side, and then I've got my tube to place on the other side with my sample in it. I'm going to shut the lid, and then I will turn my timer to 5 minutes. All right, and it's gonna spin for 5 minutes, and then when it's done, I will remove the tubes and we will continue. Okay, so now our centrifuge is done. I'm going to open up my lid and remove my balance. And I'm going to remove my site. So now I have my test tube sample. I'm going to uncap my tube. I'm going to gently pour off the supernatant in this sink right here. Okay, so I'm going to go ahead and do that. As you can see, there's that little bit of white on the bottom that we were expecting to find. The centrifuge that I used uses a 45-degree angle, so it brought it up more at a slant. So I'm going to bring my sample over here. Alright, I'm going to bring my sample over here. I have my new methylene blue stain. I have my pipette right here. So I'm going to open up my stain. I'm going to use my pipette to take one drop. Press that stain back. And then I'm going to go ahead and close my stain. And then I'm going to use my pipette to mix it around. I want to make sure that I get all of that white plug on the bottom mixed in. Alright, so I'm going to pick up a drop. And then I'm going to place that on my microscope slide. Right. Down. And we'll stay in there. Perfect. And then I have a glass cover slip. So I'm going to go ahead and place that on top. There we go. And now I can examine under my microscope. Right, so now I'm going to examine my slide. I've got my microscope on. I'm going to go ahead and set it down. Raise my stage up. And I'm going to start on 10 times magnification, and then I'm going to increase because I'll be examining at 100 times magnification and 400 times magnification. So I've increased to my 50 times magnification to refocus before I get to my 100 times. Okay, so I've moved to my 100 times magnification. I'm going to start in one corner of my slide and methodically move through to check for any sort of microfilaria. So that is the end of my 100 times magnification. I didn't see anything, which is good. This dog hasn't been on heartworm prevention for a while, so we were worried if she would be positive for heartworms. I am, however, going to examine some of our more clustered areas with the 400 times magnification just to be sure. Okay, so that concludes my test. Based on what I see, I do not think that this dog is positive for heartworms, which is good for her. So I'll let my doctor know. So a little bit about our fecal testing, the different types and why we choose to do them. So for our direct smear, it's going to be the simplest evaluation. Multiple bodily fluids can be examined through this smear. It's not a very good test for your parasites because you're only taking such a small amount of feces that it's likely that you would miss something that was present. So that's only going to be used if you're really just looking at more like fluid content and what is kind of making up those feces. For our simple float, that's going to be the easiest and most thorough option to check for parasite eggs. That's what normally is done in private practice. Our simple float with centrifugation, I think that's how you say the word, is going to be just like our simple float, but it's going to be a little bit more thorough. It's going to be able to catch more parasite eggs and cysts through that feces that we collect. The only thing that's difficult about that is it does require more like a special centrifuge because you use larger centrifuge tubes than what a lot of practices have the capability of. And then our sedimentation test is really only done for large animal parasites, or if we're thinking that a patient could be infected with the parasite where the eggs are going to be too heavy to actually float in that Decamed solution. So that's why we're going to do the different tests that we have. And we'll go ahead and demonstrate how those are done. So now I'm going to do our standard fecal flotation. So what I'm going to do is I'm going to use my designated cup to mix the fecal matter with my fecal med solution. I'm going to use this tube and gauze to pour it into as well as strain it. And then once I get it almost full, then I'm going to move it over here, fill it the rest of the way, and place my glass cover slip on top and let it sit for 10 minutes. So I'm going to go ahead and do that. Okay. Good. Right, mix it in my cup. See right here, and put that in there. Alright, I'm going to get my fecal med solution in there. There we go. I'm going to fill it almost to the top. And make sure I mix it really, really well. Alright, so now it is mixed thoroughly. I'm going to go ahead and pour it into my vial. Alright, looks good. Go ahead and close that. I can remove my straining gauze. Good deal. And then I'm going to set this right over here so I can fill it up to the top. I'm going to fill it up all the way. What I want is to make a convex dome on top, so I'm going to fill it up just a little bit, get some of that surface tension, not overflowing though, you can see that. There we go, it's got a little bit of surface tension. Alright, and then I'm going to take my glass cover slip, which is right here, and set it on top Alrighty, so now it's going to go ahead and sit for 10 minutes. When that's done, I'm going to take that off of the top of my vial and I'm going to place it on a microscope slide and then we'll read it. Okay, so it's been 10 minutes since I started the fecal flotation, the simple fecal flotation. So I'm going to go ahead and put that glass cover slip on a slide and we'll get to look at those. I'm going to go ahead and put some gloves on first. So I'm going to go ahead and grab my sample. Okay, so I took it off of the top of my vial and placed it on my microscope slide. Alright, so I've got my slide right here on top of my stage. I'm going to go ahead and we're going to be examining this at 10 times magnification. I'm going to go ahead and raise my stage up. I'm going to get my microscope in focus. Excuse me. Alright, I think I'm in good focus there. So I'm going to start in one corner of my slide and methodically move through the entire slide to make sure that I catch any possible parasitics. Alright, so that's the end of my sample. I did notice a few hookworms, probably only just one plus, really nothing much there. But I'm going to let my doctor know. This dog was coming in for some bloody stool, so hopefully this will be able to resolve the issue. And that's going to be the end of my test. So now I'm going to be doing our fecal float with our centrifuge. So I've got my designated cup, my red top tube that I'll strain it into, a tongue depressor to get the feces, as well as my gauze. And I've got my fecal med solution to put into my cup. So go ahead and get started. I'm going to go ahead and get my small amount of feces. Alright, so I've got that right there. I'm going to go ahead and place it into my cup. There we go. Put that down. Fill with some solution. Alright, and then I'm going to make sure I mix it up really well. Alright, so now that that's mixed, I'm going to go ahead and get my red top tube, place my gauze over the top, and then I can go ahead and pour that in. So, oops. And it's actually straining. Alright, I'm going to go ahead and close that. And then it's full almost all the way to the top. So I'm going to go ahead and pour out just a little bit into my little paper towel. Alright, that looks good. Gives me enough room to fit my cap back on. I'll go ahead and add my cap. And then we're going to go take this to the centrifuge. So now I have my sediment and we're going to walk back and set it up. Alright, so now as you can see I brought my tube back as well as kind of rigged a little way to set it up. So I'm going to go ahead and open that. There we go. I'm going to fill the rest of it with my Fecal Med solution. I'm going to fill it all the way up to the top until it gets that sort of convex top. That looks good. And then I'm going to place my glass cover slip. Let's see, and set it directly on top. Looks perfect. So now this is going to wait anywhere between 10 to 15 minutes, and then we'll read it on a microscope slide. Right, it's been about 15 minutes since I did my centrifuge fecal flotation, so I'm going to go ahead and grab my sample and then set it on my microscope. So I'll get my microscope cover slip, set it on top of my microscope slide. Sorry. Alright, so I got that set down. Kind of see that right there. Go ahead and set it on my stage. And I'm going to bring my stage all the way up. Just like the other tests I am going to start in one corner of the microscope slide sample, one corner of the microscope cover slip, and methodically go through my slide just to make sure that I don't miss anything. Okay, so I don't think I had as much to look at for this one. I think there must have been maybe a couple pieces of fecal matter that caused all of the solution to move towards one side of the cover slip. You can kind of see that. Anyways, so on this cover slip, for our sediment, our fecal float using centrifuge, I didn't really see anything as far as parasites go. I did see what I think is some organic material, like maybe some grass, but nothing that I would be concerned about. So that's good. So now I'm going to be doing our direct smear. I'm going to take a cotton tip applicator and I'll use the base end of it. I have my microscope slide. I'm going to put a little bit of feces on my slide, put a little bit of Fecal Med solution on top, mix it together really well, and then smear it out. Then I'll remove any sort of like larger fecal debris. That way I can place my cover slip on top and examine it under the microscope. So do a little bit of feces. Alright, I think this looks good. Hopefully you can see this pretty well. So I'm going to take this, set a little bit on top. I'm going to put a drop of my solution. I'm going to mix it around really well. Alright, so got it mixed up pretty well on there. I'm going to go ahead and just drag the base of my cotton tip applicator across very lightly. Kind of smear that out. Like so. There we go. And then I'm going to place my glass cover slip on top. Just like that. And I can go ahead and give it a read. Okay, so I made sure to clean off the base of my slide before I examine my direct smear. I'm going to go ahead and set this on my stage. Like so. I'm going to raise up my stage and get it in focus. And then I'm going to start in one corner of my cover slip and examine all the way to the other side. I am going to be examining on 10 times magnification. Okay, so that's the end of my slide. I didn't see anything on here, but I'm definitely going to have my doctor take a look. But as far as I'm concerned, there are no parasites seen. Okay, so I'm going to be doing our fecal sedimentation. So I have my designated cup that I'm going to mix in with my fecal matter. I'm going to get that out using a tongue depressor. And then as well as I have a red top tube for it to sit in, and it's going to be sitting for 30 minutes. So we'll go ahead and get started. I'm going to get about 2 grams of my fecal matter. That looks good enough. That's what I got right there. I'm going to go ahead and get that into my cup, like so. And I'm going to fill it with tap water. Alright, and I'm going to mix it. Alright. I think that is good. Put that down. Next, I'm going to strain it into my red top tube. Set my gauze sponge over the top, like so. Alright, so I've got my gauze over the top to strain it, and I'm just going to pour it directly into that tube. Alright, a little bit messy. Typically we do this over the sink, but there's not really a good camera angle over the sink, so. Alright, I think that's good. Get that out of the way. Alright, as you can see, I have my fluid right here. So I'm going to go ahead and recap that, and then I'm going to let this sit for 30 minutes. Alright. as you can see, that is my sample sitting up to be undisturbed for 30 minutes. Alright, so it has been 30 minutes since I started my sedimentation test. So I've got a pipette with me. I also have a microscope slide to examine and a glass cover slip. So I'm going to go ahead and grab my sample. Got that right here. I'm going to go ahead and suck up the majority of the supernatant on top. I'm going to be sure to not disturb the sediment. It's going to take a little bit more. Put this up. Alright, that looks good. That's pretty much just about to the sediment. Alright, and so now I'm going to reach in and get just a little bit of that sediment itself. Alright, and then I'm going to drop that on my microscope slide. Perfect. Go ahead and cap my sample. And then I'm going to cover it with my glass cover slip. Okay, so now we're going to examine that slide. I'm going to go ahead and set it down on my stage. Bring my stage all the way up to the top. And I am looking at the 10 times magnification. I'm going to start in the corner and go ahead and focus my microscope. Alright. My eyepieces focus as well. And then I'm going to just go through pretty methodically all the way across my slide. That way I can make sure I catch anything that might be on the sample. So I made it to the end of my slide. I didn't see anything on there, just normal fecal material, maybe a few hairs, but that was probably my fault. That being said, I think that he is all clear when it comes to our sedimentation test. So a little bit about the different kinds of urine collection. So we like to use our free catch samples for any sort of just like urinalysis or specific gravity. We like them because they're the easiest to do and the cheapest to do, but unfortunately they can't be used for any sort of cytology or culture. So if that's what our doctor is looking for diagnostics, then we're not going to be able to do that or use that method for those tests. Our ideal way to collect a sample for cytology or culture, for culture is going to be our cystocentesis. There's 3 different kinds of cystocentesis that are typically done. You have your blind stick, you can have your palpation, or you will locate your bladder, and then you'll have your ultrasound guided cystocentesis. Where you find the bladder, you can see the void, which is kind of the fluid that's present in the bladder, and then stick your needle and syringe down to get your sample. The cystocentesis is the gold standard. That's what we would much rather have. But in times that you cannot stick into the bladder, such as maybe there's a bladder tumor or something that you're worried about rupturing in particular, you can pass a urinary catheter. For our male urinary catheterization, it is not the best that we could do. We'd rather have a cysto, but when in doubt, it will be very handy for cytology and for culture. There's a few different types of urinary catheters we can use. So our red rubber and our polypropylenes are going to be our most common for just our temporary samples. But then there are like Foley catheters if you plan on placing them for a longer period of time, where they'll be not fully permanent, but they will be stationary for a while. So that's a little bit about our urine collection methods, and now we can demonstrate how to do those. We're going to perform our free catch urine collection. So what we're going to use today is going to be this hole we've got. It holds a little cup on the bottom of it, and then this disposable plastic cup that will fit in to collect the urine itself. To get the sample out of the cup, I'm going to use a 10 cc syringe as well as the casing, and then I have my red top tube and my needle to place on my syringe to put the sample into a red top. So the main thing that we're going to use this urine for from the free catch is going to be just for our urinalysis, kind of take a look at it. It's not going to be used for any sort of cytology or culture because of its likelihood of being contaminated in that aspect. When we obtain our samples, we want to make sure that we obtain morning urine. It will be the most concentrated, so that's going to be where we're going to get our best results and most accurate results, as well as we want to make sure that when we are collecting our sample, that we collect midstream, so not the first initial urine to come out and not at the very end that would likely not come out in a good stream, but right in the middle. So I'm going to grab my patient. He is going to be coming in because he needs to get his specific gravity checked because we're not really sure if he's concentrating well enough. So I'm going to grab him and we're going to go ahead and perform our free catch. I'm going to walk the patient out into the grass. As he starts to urinate, I'm going to use my cup to pick it up. And so we're going to go ahead and go. So I waited until some of the stream came out initially to go ahead and miss the beginning. Then I'm going to go ahead and collect my sample. That looks like plenty. I've got my sample here. I'm going to wait until he's done. So much. So I'm going to make sure that I've still got a good hold on my patient. I have my syringe with me. I'm going to go ahead and open that and not lose my cup. My syringe. I'm going to go ahead and draw it up. That looks like plenty. And I'm going to place it back into my casing. That way I don't have to worry about it leaking. And then I'll take it inside to put it in a red top tube. Okay, so now I am back inside with my sample. I'm going to go ahead and get a 20 gauge needle. I will remove my syringe from the casing and place the needle on it. And then I have my red top tube right here. So I'm going to go ahead and uncap my needle, place into the red top tube, let it fill up all the way. And then I'm going to not recap my needle with my hand. Go ahead and get that needle back on. And here I have my sample. I'm going to make sure that it's labeled. And then go get that specific gravity ran. We're going to be doing our cysto. My technician has a 10 cc syringe with a 22 gauge 1.5 inch needle. We're going to do some alcohol in her abdomen and do an ultrasound guided cysto. So she's going to put some alcohol on her ventral midline. We're expecting the bladder to be just caudal to her umbilicus. So we're going to uncap our needle. She's going to poke right on that ventral midline, dorsocaudally, into our bladder. We're going to aspirate back our urine. She made sure not to redirect her needle while she was poking for the bladder. Right? And then she's going to go ahead and remove the syringe and the needle from the patient. She was in dorsal recumbency, so I'm going to go ahead and take our sample now. I'm going to bring it over, get another needle, so we can change that out. I've got my 2 red top tubes. This way. I'm going to go ahead and unscrew my needle. I'll place a clean needle on, that way to avoid contamination with my sample. Go ahead and uncap my needle, place into the top of my red top tube, let it inject. And then I can place it into a second red top tube and let that inject as well. And that's how you do a system. You're placing a urinary catheter in this male canine, that way so we can get a sample. So what we're going to do first is he's going to get in the lateral recumbency. We have our SpO2 monitor on him, as well as our technician is going to be monitoring his heart rate the entire time. So we've got our red rubber. We're going to estimate the length of the red rubber based on double the size of the length of his penis. So about right there, so we're going to double that. So we're going to probably insert it about this far. This is our sterile red rubber catheter. I'm going to go ahead and open up, or should I do like now? I'm going to go ahead and open up these sterile gloves for my technician. Let her close. So I got my betadine swabs so that I can clean his penis. I'm going to come over here. And we're going to extrude his penis. I'm going to go ahead and clean that really well. Do one more just for good measure. Next, I'm going to open up our sterile loop. It's been sterilized. Open that for my technician, as well as open up our sterile catheter. There we go. So she's going to be inserting this catheter. I'm going to take the initial sample, which is going to be about 2 mL, and then discard it. Because it's likely to be contaminated, and then I'm going to draw the rest of the sample. So she's going to go ahead.
Is this an 8?
Yes, it might be a 5. Okay. Yeah. All right.
5 to be kind.
We're going to go ahead and open up just a smaller catheter. It's a little bit big for him. All right. So there is that 5 French red rubber. She's going to sterilely lubricate the end of the catheter and then insert it. First part of the sample. Can do it. There we go. Let's try it. Alright, so that could be all that we're going to get initially, so we'll go ahead and remove that just in case we want to make sure that we don't waste that sample. Then I'll go ahead and attach my 12 ml syringe. little bit. Little bit. It wants to.
No.
Might pull your catheter back a little bit. Might be like bumping up against something. Ryan's has an empty tank.
He says, I just went potty and I haven't drank water yet.
All right, but you know what? We got a little bit of a sample, so we're gonna go ahead and remove that. So there's a little bit of my urine. I'm also gonna save the other syringe just in case, because it isn't much of a sample. I'm gonna go ahead and attach my 22 gauge needle, and then I can put this in my rib top tube. Insert that in, and there's my sample. And we removed our catheter, and in case you can't see, but he's definitely very alive. Here we go. Today I'm going to be doing an ear cytology on our patient Zip. He's presented to the hospital today for shaking his ears and his ears being malodorous. Ear cytologies are commonly performed to diagnose outer ear infections. So I'm going to take my cotton tip applicator, insert it gently but directly down into the ear canal, swab around to get some debris. Perfect. I'm going to go ahead and pull that out. So this is going to be my right ear. I'm going to set it to the right side of my tray. And then I'm going to go ahead and do my left side. Same way, so I'm going to reach in the ear, very gently, move down into our ear canal. Obviously our ears are a little bit tender. And then I'm gonna go ahead and I'm gonna break the base of this stick. That way I also can remember that this is going to be my left. All right, so to prepare my slides for my ear cytology, if you look closer, I have my slides labeled with my patient's name as well as the direction of which ear it was, whether it was left or right. I am going to be making 2 slides for each ear. That way I have one slide I can stain and one slide that can just be examined under the microscope with mineral oil. So I've got my swab. I'm going to just roll it across the first slide, and I'll take the same one and roll it across the second slide. Those look good. Hold on to that just in case. As well as with my left one, I'm just going to roll it across. Make sure to get some of that debris on there. Perfect. So I'm going to let one from each side dry really well, so I'll be able to stain it, as well as I'm going to go ahead and take a drop of mineral oil, and I'm going to place it directly on the slide. 1 drop for the right, 1 drop on the left. Screw that on, and then I'm going to take my glass cover slips and place on top of my slide. Perfect. Now I can take these down to be stained and then examined under a microscope. So now I'm going to stain the slides that I let air dry. So they've air dried completely. We're going to be using Diff Quick Stain that is specifically for ear and fecal material only, not just the hematology stain. So I'm going to go ahead and pick up my first slide, and I will dip it in about 10 times. Alright, into my next stain. Alright, and now into my last stain. Alright, and then I'm going to gently rinse it underneath the sink. There's my first one. I'm going to let that one dry. Probably help if I set it up a little bit. So I'm going to let that one dry, and then I will do my right one. So as those are drying, I'm going to go ahead and examine the first slides that have the mineral oil and the glass cover slip on it. I've got my left ear slide here. My microscope is already turned on with my stage down so I don't damage anything. So I'm going to go ahead and raise my stage. Alright, I'm going to go ahead and move my slide to where I am over a likely area of interest. Oops. Focus my Okay, so right now I'm looking underneath the 10x field. So I'm going to look around, see if there's any larger bacteria that I can see or yeast. I do have a lower level light on. I'm just kind of looking for my gross examination. Overall, I don't see anything very exciting. I am methodically moving through my glass cover slip to determine if there's anything present. Alright, and I can pretty confidently say I don't see anything on that slide. So I'm going to go ahead and remove it after moving my stage down. Just set that off to the side. And then I can look at my right one. So I definitely see more debris. It does look very brown. Lots of little spicule debris across the slide. I do think based on the level of debris in the right ear that I'm likely to find more bacteria or yeast on that slide. So it will be interesting to see the stained slide. Alright, so now I'm going to go ahead and examine the slides that I've stained. So I'm going to go ahead and start with my left one. Place it onto my stage. I'm going to raise my stage. And I'm first going to examine it under low power, so just under 10x. I'm going to get myself focused. Alright, I'm going to go ahead and look around, see if I can find a good area of interest where I might see some bacteria or fungus, and then that way I can move in a little bit closer. Right, so I think I found a good area. So what I'm going to do is move my lens over to the 100 times field and get a drop of immersion oil. Place it directly over my spot. And then move my objective lens over. Get myself focused. So I do see a little bit of inflammatory cells. See a little bit of what I think is some cocci, which is normal to see a little bit. Well, I would say for this year, there's probably no significant findings. Like I said, I do see some inflammatory cells and a small amount of cocci, but nothing that I am surprised to see. So I'll go ahead and move my objective lens and lower my stage so I can examine my other slide. And the right ear was the one that I assumed would have the most debris to begin with. So, alright, so I'm going to move back to the 10 times objective lens, raise my stage, get focus. I think I found a good area here, so I'm going to shift my objective lens over, put my drop of mineral oil down. Put that 100 times lens. Go ahead and get focus. Okay. For this one, I definitely see a lot more debris. Looks like a lot more cocci are present. There's clumps where it has attracted the stain. Looks like quite a bit. For this slide, I would say that I'm probably seeing about 8 to 10 cocci present per high-powered field, which is not that much, but compared to the other slide, I think is fairly significant because they are all located together. But overall, I would say that he probably has fairly normal ears, just pretty dirty, but I'm definitely going to get my doctor to take a look at it, and we'll diagnose from there. So today we're going to be performing a skin scraping. Before I get my patient, I don't want to stress her out too much. I was going to talk a little bit about it. So skin scrapings are commonly performed to diagnose skin infections. Also looking for any sort of like external parasites like mites that could be located on our skin. It's going to be really cheap and an easy way that with good skill we can go ahead and diagnose those issues and treat them appropriately. So I'm going to go grab my patient and then we're going to get started. So I'm going to be performing a skin scraping on this dog right here. She was supposed to go to surgery today, but ended up having a little bit of a skin infection on her belly, and so we're going to go ahead and get a scraping of that. So materials I'm going to need are going to be my clipper blades, my mineral oil, I have a glass slide over here, as well as my 10 blade. So I'm going to open up my 10 blade and get it really dull, that way I don't have to worry about hurting her at all. Alright, so I've got that really dull. I'm going to go ahead and put a drop of my mineral oil on my slide. There we go. And then I'm going to prepare my blade by placing it in the mineral oil. See that? So, Alright, so I would clip the skin to prepare it, but she has already been clipped for surgery, so I don't need to do that. I'm going to go ahead and pinch an area where there's a little collarette and some crusty, pinch that, scrape it. I want to make sure I get deep enough that the capillaries bleed just a little bit, that way I know that I have gone far enough, and then I will put that on my slide. So pinch the skin just a little bit, scrape it with my blade perpendicular to the skin, with a 3 to 4 centimeter squared area. Alright, I think that's good. Place that in my mineral oil. There we go. And as you can see, there is my slide, and I'm gonna go take that and put a cover slip on it. So with my skin scraping, I made sure to scrape superficially to check for bacteria and yeast, as well any sort of like fungal issues, as well as more superficial types of mites like softies. I also made sure to scrape really deep That way I was able to check for any sort of like Demodex or Sarcoptes mange. So, Sarcoptes mites, sorry. So what I'm gonna do is I'm gonna take my slide, walk it down to where our microscope is kept, place a glass cover slip on top, and then examine it under 4 times magnification. Unfortunately, where our microscope is kept is a very busy area with lots of patients, lots of talking, and it's pretty loud. So what I'm going to do is I will walk to the microscope, place it on the microscope, video myself reading the microscope, examining the slide, and then walk back into where it's a little bit quieter, and that way I can discuss my findings. So here we go. Sorry for the trip. After examining my sample with the microscope under 4 times magnification, I did not notice any mites, so that's good. There were no mites located in the sample itself. I did see some skin cells as well as some cocci bacteria present. So I will make that known to my doctor, and they are going to come check out my slide as well. I did also increase the magnification to 10 times just to take a good look and look all around, make sure I didn't miss anything, and I am confident with my findings.